Today we're going to continue with melanoma. In part 1, we spoke about melanomas on sun-damaged skin, and today we're going to talk about other types of melanomas. There are 10 important local features or structures to aid in the diagnosis of melanoma. We already reviewed this, but let's go over it again. We look for an atypical network. We look for focal streaks. We look for atypical dots and globules, a negative pigmented network, shiny white lines only seen in the polarized mode, a eccentric blotch or eccentric dark structureless area off-center, gray dots granules in flat areas, a blue-white veil over raised areas, and vascular structures. Here we have a clinical image using the CASIO camera. And with one click of the button, you can acquire images in the contact polarized mode, the contact non-polarized mode, and near ultraviolet light. In the polarized mode, we can see the multiple colors, the streaks, the shiny white lines, and the globules irregularly distributed. In the near ultraviolet light, you can see how dramatic and striking the white lines are. And one can also take pathology images with one of the CASIO attachments. And here one sees these disc-cohesive nests at the dermal epidermal junction. Here we have a melanoma in situ. It's a subtle lesion. Dermoscopically, you have an atypical network. And with near ultraviolet light, you can see the very, very sharp outline of the pigment. In this case, we have a reticular disorganized pattern with an atypical network. Another subtle melanoma, dermoscopically, an atypical network with some brown dots and fragmented lines irregularly distributed. For this melanoma, we see an atypical network. We have some dots that are regularly distributed, and you can see multiple colors with this reticular homogeneous disorganized pattern. In this case, we have a reticular homogeneous disorganized pattern. We have this blotch off center as well as this atypical network. Another case showing a reticular homogeneous disorganized pattern with this eccentric structureless area, this atypical network, and some brown dots which are irregularly distributed. This melanoma, here we can see the focal radial streaming or streaks. We have an atypical network. We have an eccentric dark structureless area and gray dots granules, and these are all seen with the contact polarized mode. In near ultraviolet light, with structural enhancers, you can see dramatically the focal radial streaming. In this lesion here, we have an atypical network as well as dots that are irregularly distributed. If now we look in the near ultraviolet light, we can see these vessels as dots, irregularly distributed, but it's quite prominent. We use the near ultraviolet light with the vascular enhancer. In this particular case, we have a negative pigmented network, some globules that are irregularly distributed, some gray dots granules, and this atypical network. If we now use near ultraviolet light, you can see quite prominently the globules irregularly distributed and the negative pigmented network. Subtle case, one sees dermoscopically this scar-like depigmentation with this atypical network. Not all melanomas are the same, and the dermoscopy features are often different with the subtypes of melanomas. For example, melanomas in association with nevi on intermittent sun exposure, we look for a negative pigmented network. We look for the shiny white structures only with polarized dermoscopy. The globules irregularly distributed, the irregular blotch, and sometimes atypical vascular structures. So here we have this lesion All we really see are some globules irregularly distributed in the contact polarized mode. You can see this as well with the near ultraviolet light. And this is where the enhancers make a dramatic difference. Now with contact polarization with the vascular enhancer, we see the vasculature and we see the negative pigmented network. And we see with the structural enhancer the globules as well as the negative pigmented network. Here, another case with this subtle melanoma. Clinically, it looks like a congenital nevus with some unusual features. With polarized mode, we see globules irregularly distributed with the negative pigmented network, and you see this even better with the structural enhancer. In this case, globules are irregularly distributed, a negative pigmented network. All of these are melanomas in association with a nevus. In this particular case, the same. Atypical network, globules irregularly distributed, a negative pigmented network with this melanoma in association with a nevus. And then we have the shades of pink melanoma. And the key features include the vascular pattern, the white lines, the shiny white structures, and brown structures areas at the periphery, and the prominent vascular structures. The vessels as dots, sometimes they're linear random or polymorphous. In advanced cases, we often see pink and red oval structures with milky red globules, and occasionally a milky white area. So here we have an example of the shades of pink melanoma. The important features are the polymorphous vessels, vessels of more than one type, and this focal eccentric pink-brown structureless area. In this particular case, in the contact polarized mode for the shades of pink melanoma, we see the brown structureless areas at the periphery and the polymorphous vessels, and you can see that the vascular is enhanced using the vascular enhancer. Here again we show the vascular enhancer demonstrating these vessels of different patterns. Some are linear or regular, some are vessels as dots. In this particular case, we have a very subtle lesion. It's pinkish in color. Dermoscopically, we have vessels as red dots, irregularly distributed, in focal eccentric red-brown structureless areas.